Neuropathic pain is pain that is there all the time. It may or it may not be the reflection of an injury. Often it is, but sometimes it is not. And it's just pain for the sake of hurting. That doesn't serve any purpose other than ruining the person's life. It's not the pain that happens when you have had surgery or when you have sprained your ankle. It's a pain that's still there 6 months, 6 years later. A neuropathic pain can happen anywhere in the body. You can have neuropathic pain from a spinal cord injury. You can have neuropathic pain from a brain injury such as stroke. You can have neuropathic pain from treatment with chemotherapy or radiotherapy for cancer. And you can have neuropathic pain from damage secondary to surgery or trauma. So it can happen anywhere in the body. It is like a burning feeling, like a sensation of pressure. Some people describe it as if they had a vice compressing on their leg or the arm. It is the sort of pain that comes with tingly feelings, sensation of creepy crawlies on the skin. Sometimes they feel it as heat, sometimes they feel it as cold, but primarily it's pain that is always there. Doesn't come and go, can have slight oscillations up and down, but primarily is there. It is often worse at night, and that is normal. That is because it affects the normal daily cycle, the internal body clock. It gets somehow linked to that. It feels unrelated to anything that you do. It just gets worse for the sake of getting worse and improves for the sake of improving. People find it very difficult to understand and cope with the fact that a part of the body can be numb but still be very painful. And that is something that we find commonly after certain types of trauma. In terms of what we can do for people with nerve pain, we can do anything from very simple treatments. We can start at the very bottom end of the spectrum with something topical that you rub on the skin, or you put in a patch, which could be something that will not involve taking a box of tablets with you, and certainly will have very limited side effects. Then, if those things don't work, then we can escalate it to tablets. The type of painkillers that we are talking about are drugs that were developed to treat the nerve system, and along the line we have found that they have an effect on pain management. And those drugs can have an effect as well on the brain, which is what they were originally designed for. In between, there are a couple of other treatments which involve infusions of nerve painkillers into the vein that are done probably once every 3 to 6 months, depending on response. And they can be fairly effective, they can be relatively long-lasting. They have virtually no side effects, and most patients tolerate them well. And probably about 60 to 70% of patients with nerve pain will improve with this sort of infusion type of treatments. It's possible that we can help some types of nerve pain with injections, which can be done with drugs or can be done with electricity techniques. And eventually, if everything has failed, the top end of the spectrum would be something called spinal cord stimulator. Spinal cord stimulator is a pacemaker type of device that is implanted around the spine. And what it tries to do is send electricity towards the spinal cord to try and take over the signals of pain, primarily, that come from different parts of the body. So that is probably about the most effective way of treating nerve pain, but it's fairly invasive, and that is where we keep it towards the end of the spectrum. Pain medicine, you have a working relationship over years. I have patients that I've been seeing them for 10 years, and that can be very rewarding.